Hello everyone, this is Dr.Madupu. So this video is the continuation of pelvic inflammatory diseases which we have discussed earlier. So in the earlier video we have seen what is pelvic inflammatory disease and what are the causes, signs and symptoms. So now let us see how the patient will present. So the patient presents with the following symptoms and signs. So she will come with bilateral lower abdominal pain. She also presents with abnormal uterine bleeding or abnormal vaginal bleeding. This may be postcoital bleeding, intermenstrual bleeding or menorrhagia. She also presents with a deep dyspareunia, that is a pain during the sexual intercourse or after the sexual intercourse. And then she also presents with the abnormal vaginal or cervical discharge, maybe in color or odor. And signs. When coming to signs, she will present with the tenderness of lower abdomen. And there will be mucopurulent discharge, mucopurulent cervical discharge. And we can also see on bimanual examination that cervix inflammation is present, that is cervicitis is present. On bimanual examination we can also note cervical motion tenderness and adnexial tenderness. Some patients may also present with fever and chills. Mostly they present lately, so that's why some patients may present with fever and chills. So now let us see how to diagnose PID. When a pregnant lady comes for the pregnancy test and if you suspect PID, then you should differential diagnose it with ectopic pregnancy also. Then you can do cervical swab test. If at all the cervical swab test is positive for chlamydia and gonorrhea, then it is confirmed as pelvic inflammatory disease. But if it is negative, then also you should suspect PID. If there is elevated ESR, then you can suspect PID. You can do endometrial biopsy or ultrasound scanning. And there is another procedure, that is laparoscopic procedure, to find out pelvic inflammatory disease. But it is not used so much because it is an invasive procedure. So this is the criteria of diagnosis for PID. So the treatment of pelvic inflammatory disease is mainly by antibiotics. But first of all, we should assess all. So the treatment of pelvic inflammatory disease is mainly by antibiotics. But we should also see all these criteria. So if the woman has intrauterine contraceptive device, then we should assess whether to remove it or whether the infection is causing any disturbance. And we should also see that whether she is already diagnosed with any sexually transmitted disease or not. And if at all present, then we should treat it. Then the antibiotic regimen is ceftriaxone 500 mg single intramuscular dose, doxycycline 100 mg orally twice daily for 14 days, metronidazole 400 mg twice daily for 14 days. And if the person is diagnosed with chlamydia or gonorrhea or any other anaerobic infections, then broad spectrum antibiotics are given. If the patient is severely ill,